I'm Kate Czaplinski for the HAN Network. May is Mental Health Awareness Month, and we're looking to raise awareness and start a conversation here at Silver Hill Hospital in New Canaan. I'm joined right now by Dr. Aaron Krasner, who is the Adolescent Transitional Living Service Chief. Dr. Krasner, we've had you on before, and we're happy to have you back.
It's really great to be here. It's always fun.
Well, we're going to talk a little bit about a very important topic. When is it time to seek professional help for your teen, which can be something difficult to figure out? One of the reasons being, teens go through emotional mood swings. So how do you differentiate between a mood swing and something more serious?
Yeah, that's the question. It's a question that I think is really important for parents to be educated about. And what I hope your viewership, listenership, readership, the ships can learn from this is a concept of impairment. So all of us go through moods, difficult times, fatigue. Various factors can impact our moods and make us brittle in a particular day, moment, spot, even a couple days. When these symptoms prolong and or when the moodiness is very, very intense, it can lead to impairment. And impairment is when you can't do the stuff that you're supposed to do. So teens are supposed to go to school, they're supposed to do their activities, they're supposed to do their homework, they're supposed to have friends and have somewhat normative relationships with their parents. And when these important hallmarks are impacted negatively by symptoms and cause kids to struggle in making good on their obligations as teenagers, then there's a sign that there's a problem. And more specifically, there's a sign that there's an illness process. And it's important to remember that problems are problems and illness is illness. And that's why I'm talking about impairment. So when problems accumulate, they hint at and can ultimately define a clinical syndrome, which represents a brain-based illness that can be treated and must be treated. That line can be very blurry for certain people in certain cases, and there are lots of different factors for us as parents. Some of us want to get help for our kids, some of us don't. Some of us want to acknowledge that there's a problem, some of us don't. And so there are some objective measures. If your kid's not going to school, that's something to look at. If your kid is persistently irritable or sad, and your kid is persistently uninterested in the things that he or she used to like to do, those are the two most important symptoms of depression. And if they are prolonged, that is a reason to seek help, or at least a consultation. A good place to start is a pediatrician.
And now this kind of goes along with that, but often teens want to be left alone. But when can that kind of raise a red flag for intervention?
Yeah, being left alone is an important thing for many of us. Some people are extroverts, some people are introverts. And when you're an introvert, being alone can recharge you. If you're typically an extrovert and suddenly you're reclusive, that's a pretty big behavior shift and should draw your attention. And the other major demarcating factor, you might say, is if there are signs of impairment. That is, they're no longer playing field hockey, they're no longer playing basketball with their friends at the park, and they're not going to school and their grades are dropping, and you have other kinds of problems, and you have a kid who's behind closed doors, the significance of that behavior changes. So you have to evaluate the meaning of the behavior in a context. So if someone has a rough day and they took a test, a lot of kids just took the ACTs, and they came home and they closed the door and they turned on their music and faced, chatted, snapped, kicked, whatever it is that they're doing, then that would make sense, right? But if it's in the context of impairment, where there's a safety concern or the child is unable to do the stuff that he or she has been doing, then that's really a sign that we need to perhaps take action and seek further help.
Now, when it comes to indications of a mental illness, what are some of the concerning behaviors?
So behavioral health is a tricky and complicated field for this whole reason that we're talking about, that all of the behaviors that can ultimately cluster as syndromes that need attention medically or psychotherapeutically are normal. Everyone gets blue, everyone gets sad, everyone gets anxious for a test or a performance. A lot of people drink, they drink socially. Some people watch their weight and want to look a certain way. It is when these problem behaviors cross a line, and how you draw that line is a matter of scientific inquiry all the time. But how you draw that line is the most tricky and the most important part of behavioral medicine. So the signs and symptoms to look for in teens suggestive of mental illness most commonly are depression and anxiety, which genetically are very similar. Depression in teens, as I alluded to earlier, tends to look like prolonged period of irritability, low mood, and what we call anhedonia, or a lack of interest in the things that the kid used to like to do. That then, when it's coupled with difficulties concentrating, low energy, problems with sleep, and thoughts of self-harm, constitute a clinical syndrome that we call adolescent depression. Adolescent depression is very, very treatable. It is highly heritable. And the literature has exhaustively looked at best ways to treat adolescent depression. And the best way to treat adolescent depression is a combination of psychotherapy and medication interventions. Now, when to do meds, when to do therapy, all becomes a question that is a case-by-case question that answered answered by a qualified mental health care professional. And to make that decision, you hope that your teen can be evaluated by someone, certainly a licensed mental health practitioner, and ideally you would start with either a child and adolescent psychiatrist or psychologist so that you can diagnostically get a clear sense of what is going on, because in addition to depression, there are many coexisting disorders that can be sometimes tricky to suss out and know exactly what's going on. With respect to anxiety, the most common forms of anxiety that our kids suffer with is persistent worry, or what's called generalized anxiety disorder. And in generalized anxiety disorder, kids are anxious, worried, nervous, scared for a prolonged period, probably about 6 months, and typically it's associated with some somatic complaints. They have persistent abdominal discomfort, they have headaches, stuff like that. And that's a very common presenting complaint to my practice and to a lot of people's practices, unexplained belly pain in young kids. But in adolescents, a lot of worry, checking, make sure the homework is done and complete, and some obsessive symptoms can cluster in there. Not necessarily that would meet threshold for a diagnosis of OCD, which is an anxiety disorder, but obsessively worrying and ruminating is a sign of anxiety. And anxiety and depression very, very often co-occur because genetically they're so similar. And just like depression, there's been exhaustive studies of how to treat adolescent anxiety, and there are FDA-approved medications and evidence-based psychotherapies to treat anxiety. So these are solvable problems, and if you guys out there in your viewerships, in the ships, are suffering, don't suffer alone. Please reach out for help and speak to your pediatrician and speak to your primary care physician and speak to people you know who've been through this, and find someone who can be helpful.
And now, how do parents talk to their teenagers about what some of their concerns are?
Oh,
It's a hard one.
super duper hard. Here's the best hint. The best hint is to be gentle and to be validating. Those are the two things that if I could influence in any way anyone's approach to talking to a teen about a mental health condition, probably about everything, but in particular about a mental health worry or concern, to be gentle and validating. So what does that mean? That means that you're going to carve out some time and you're going to speak in a low tone, and you're going to do it not when the younger sister has ballet and dad's coming home in a bad mood and late, but rather you're going to, if you're the father or you're the mother, you're going to carve out a few minutes and you're going to say, is this a good time to talk? And they're going to say no. And then you're going to say, when's a good time? And then you say, okay, let me circle back. And you follow up. You sit down and say, look, I've been noticing blah, blah, blah. And I love you and I care about you. And I wanted to hear a little bit about it. And you can expect that the teen will not tell you anything. And that's okay. And when they tell you nothing, you then kick into the validating stance where you say something like, it might be hard to talk to me about this. I get that. I get that. When people feel understood, they feel better. I get that you don't want to talk to me about that. Would you be willing to talk to someone else? Because I'm pretty concerned. So that's a good first pass.
That's really great information. Is there anything else you just want to say on the topic of, talking to your teens about this, or kind of figuring out when you need to seek professional help?
The things I'm seeing in my practice, and the things that are really impacting teens now, are not just depression, anxiety, and other psychiatric conditions, but substance use and eating disorders are highly, highly prevalent. And those illnesses are sneaky kind of illnesses, because there's a lot of shame bound in substance use and in eating disorders. So I see quite a lot of that. And I also see patterns of relational aggression and bullying at school contributory to some of the underlying vulnerabilities that these kids have. And finding a way to successfully negotiate with schools about issues of relational aggression, that's being excluded. It's not quite meeting criteria for bullying, right? Mm-hmm. But it's like being excluded or being passed over when you're picking teams, that sort of thing. And then frank bullying, those social perpetuating factors for teens are worthy of keeping tabs on as parents. So I urge everyone to be involved. I urge everyone to try to stay connected. And it's tough to be. The most important thing I'm going to tell you is it's tough to be a teen. Mm-hmm. It's tough to be a teen, and I'm going to go one step further. I'm going to say it's tough to be a teenage girl. And the pressures on our young women are beyond. Guys, I'm sorry, but the pressures on young women to look a certain way and to behave a certain way and have a certain friend group and be, everything to everybody all the time is so much pressure. And to the extent that parents can alleviate some of that pressure at home, I really hope that they can, because our kids are just under so much pressure.
And as you said, help is available if it's needed.
Help is available. Here at Silver Hill, we have a variety of inpatient and outpatient programs, and there are providers in the community. And I would be happy if people wanted to email me. All you have to do is Google Krasner, Krasner, and Silver Hill Hospital, and I can kind of point you in the right direction.
Dr. Krasner, thank you so much. Great information. We really appreciate it.
It's my pleasure. Thank you.
All right. Well, you can find more of our coverage and our partnership with Silver Hill Hospital this month at han.network. We'll see you next time.